Namaskar, I'm Harpreet Kaur and I welcome you all to our live and interactive special online series on understanding autism, seeing trends beyond differences. You're watching us live on PME Vidya channel number 31. That's our special ISL channel. You're also watching us live on our YouTube handles NCERT Official and NCERT Events. It's a special series which is on raising awareness regarding autism spectrum disorder or ASD, and this series is organized by CIET NCERT. It's very important to understand that ASD or autism is not any kind of illness. It's a condition that can be successfully managed through intervention strategies. Now, it is a neurodevelopmental condition which is characterized by unique behaviors and different type of learning styles, and of course there are changes in social interactions, but there is nothing strange about it. It's just that kids having autism are different. We all are different from each other. So there is just a difference in social settings, in their behavior, in their of course learning styles, and of course in their ability to grasp things. Every year on April 2, we celebrate Autism Awareness, and it's observed and celebrated globally. Why I'm saying that? Because we're having this series in the month of April and there's a special reason behind the same. Every year this day is celebrated with a special theme, and this year's theme has been Autism and Humanity. Every life has a value. Indeed, every life has a value. We can't say that people having certain conditions would not or should not be allowed in certain settings because they cannot adjust to that. No, we need to facilitate them. We need to provide them equal opportunities as all of us are getting, be it in education, be it at workplace, be it in any kind of social gathering. And that is why NCERT is organizing this 4-day live interactive session where we are trying to understand autism. We are trying to raise awareness about the same. We are trying to understand that how people overcome these challenges and manage their conditions successfully, and how we can deal if we find somebody who is having autism. What is the correct way to talk to them? What is the correct way to understand where they are coming from? So there are a lot of things that can be done to promote equity and inclusivity in education, and it's a small effort from our side. Yesterday was day 1 of this particular series where we talked about understanding autism spectrum disorder. We understood the definition, what it is all about, and how people with autism just look at things differently. They have different perspectives. Like we all have different perspectives about things. We see things from a different lens altogether. And today, because beyond understanding, it's also important to identify the early signs of autism so that we can provide the intervention strategies right on time. That is why the topic that we have chosen for day 2 is early identification, assessment and certification. Now, since it's a training program, which means there is going to be a quiz also on day 4 of the training session, I will tell you all about it on the last day itself. But if you want to know more about the guidelines, just log on to our CIET website. When you will attempt the quiz and you score more than 70%, you will be granted a certificate. For that, you need to watch all our live sessions very carefully. Now, in order to throw light on this particular topic, we are joined by our experts. But before that, because we talk about providing equal opportunities, equal access and inclusion to everybody out there, we also do the same through our sessions. That is why we are supported by our Indian Sign Language interpreters in the session. Right now, you're watching on screen Mr. Dev Malik, and he'll be supported by Ms. Anu Malik. We welcome both of you to the session. There are so many questions in my mind when it comes to early identification, assessment criteria and intervention strategies. I'm sure you also have those questions on your mind. Maybe you have people around you who are autistic. Maybe you want to know more about it so that you can try to bring them on the same page and be an ally and promote inclusion. So whatever it is, feel free to get in touch with us and speak directly to our experts. Our phone number is 880044 0559. We also have a dedicated email ID, that is dth.isl31@ciet.nic.in. And on our both YouTube handles, NCERT Official and NCERT Events, you can send us your questions, suggestions and your feedback. Now let me introduce you all to my guests for the session who will throw light on the topic. So please join me in welcoming Dr. Mary Barua from Action for Autism. Ma'am, namaskar and very warm welcome to the session.
Thank you.
We are also joined by Ms. Ruby Singh from Autism Society for India. Ma'am, namaskar and very warm welcome to the session.
Thank you.
Right. So yesterday was a very significant day. We laid actually groundwork for this particular series and for our own understanding. Today, let me start with very pertinent question. We tend to label people. She's having this kind of problem, or that person is suffering from this problem. We start judging that person or identifying the person with the kind of condition he or she is having. That's absolutely not acceptable, because we all are just different from each other. So, Mary ma'am, I want to ask you that ASD or autism spectrum disorder, it's a condition which can be successfully managed, yet we label people. Do you think that we should be doing it? Why these people are just different from us and not strange, or from some alien planet? How would you explain it to all the laymen out there, including us?
Okay, so first of all, I want to just start by restating a few things that would have been covered in the session yesterday by Mrs. Indrani Basu and Dr. Thomas Kishore. So what we know is that autistic brains work differently, right? Like you just said. And the synaptic pruning does not take place in autistic brains the way it does in neurotypical brains. And if you look at the next slide, the one with the two brains, yes.
Right.
If you look at it, the autistic brain, when there is any stimuli in the environment, the autistic brain takes in way too much information than the neurotypical brain. And what ends up happening is there is an information overload. So as a result, autistic people, they tend to perceive any stimuli that they get, and they process that and experience and interact. कोई भी stimuli हो, वो auditory हो सकता है, हम एक moving bus में खड़े हैं तो मेरा body कैसे balance कर रहा है. All of that is different kind of stimuli.
Yes.
There is too much of this that is coming in, and therefore the way they process, experience and interact with the world around them is different from those what we call neurotypical brains, right? So whatever they do is the outcome of their different brain functioning. और हम जिसको बोलते हैं, if you go to the next slide, is it's like having a different operating system. हम लोग सब कोई mobile use करते हैं, we use Android, you use Apple. Now it's not that one is better or worse than the other. दोनों ही, they have the capabilities in completing all tasks. They just do it differently, and they focus at being good at different things. So to get to the next slide, autism is a different neurobiology. So like Harpreet, you said that people are different. Yes, they are different, but they are also autistic. And the point is that using a label is not bad. Just like if I say that, I'm Bengali and you are Punjabi or somebody else is Gujarati, the label by itself is not bad.
Okay.
What is bad when we use the label and make a judgment based on what we presume. Say a Punjabi is like, oh, Punjabi log to aise hote hain, are Bengali to aise hote hain. Those assumptions that we stick on the label, and that is what is bad, because the label per se बहुत ज़रूरी है, because if I do not know that a person is autistic, and like Ruby said just before we started, that we have to understand their behaviors with the autistic lens. कि ये क्यों कर रहा है? You can't judge them just any other way. So we have to have the label to be able to provide them the services that they need. Like we got to have the label of somebody being blind to be able to provide the person the services they need.
That's right.
So the autistic person, you need to have that label. And saying that we should not label is suggesting autistic people should be ashamed of their label.
That's right.
Why should we be? I'm not ashamed of being a Bengali. Somebody else is not ashamed of being a Gujarati. Somebody else is not ashamed of being an Indian. All of us, we are not ashamed. These are all labels. Being autistic is what they are. There is no shame in that. So a label is fine. What is critical is not to say this person is autistic, therefore can't do this, can't do that, can't do the other. and coming from that perspective.
Very, very well
Right.
said, ma'am. Very well said. In order to facilitate, in order to provide them the opportunities, as rather customizing the opportunities as per the requirements and to provide them appropriate support, it's important to label, but not coming from a space where you are just judging them that they can't do certain things because of the condition they are having. ऐसा नहीं करना चाहिए, because हम हर चीज़ को न्यूरोटिपिकल वे में क्यों देखें? We must look at things as neurodivergent. They're just different, because when we talk of diversity, diversity हर जगह होती है, cultures में भी होती है, human beings में भी होती है, हमारे behaviors में भी होती है. And then your PPT also says it's just a different kind of neurobiology.
Yeah.
Right.
So, keeping in mind the different brain functioning of autistic people, some of the early signs that we might encounter, one is that they may not respond to their name. This is the one जो parents पहले आता है, बोलते ये नाम बुलाते हैं, respond नहीं करता है, बोलता नहीं है. That's another very common one. So a lot of people will not speak. कुछ है जो बोला था, but बोलना बंद कर दिया है.
That's right.
And some who speak, yes, but whatever speech they have उसको functionally use नहीं करता है. Right? So you have that as well. तो काफी words बोलता है, मामा पापा बोलता है, मगर मामा को address करके मामा नहीं बोलता है. Right? So may not be functional. And oftentimes parents will think initially कि शायद मेरा बच्चा deaf है. But they are not deaf, they are just autistic. And the other thing to keep in mind कि उसका receptive understanding is pretty good. They may not be expressing, but their receptive understanding is good. But despite that, they may not often follow instructions. हम बोलेंगे, please, मेरा चश्मा ले आ. They won't do it. Bring me the mobile, they won't do it. And they are not doing it, not because they're being disobedient, because their mind is so overloaded with information and their focus is on what they're looking at right now. For them to shift that focus, और हम जब बोल रहे हैं कि instruction दे रहे हैं, उसको follow करना उसके लिए difficult होता है. The another common, early sign is that हमारा बहुत सारे common gestures होता है, like bye bye, जो बच्चे कर लेते हैं. Or they nod their head, yes. खाना खाया है, yes. मिठाई खाएगा, yes. So many of the autistic people, if they have autism, then chances are they will not be doing that. Another very significant one is that autistic people, they enjoy playing differently. Neurotypical children play in a particular way, right? So we will have a house and we will put families in it. गाड़ी रहेगा तो we'll pretend that हम वो गाड़ी को चलाकर petrol pump पे oil भर रहे हैं, accident हो रहा है. Autistic people like to play differently. They'll have cars, they will line up their cars. If they have animals, they'll line up their animals. घर का चीजें लेकर they want to line those up. They like to spin objects. कोई भी चीज मिलेगा, they like to spin it, or they like to spin themselves, अपने आप को spinning around. They like enjoy that, right? They'll do things like looking out of the corners of their eyes. They will tend to flap their hands, rock their bodies, right? Repeat the same phrases. You'll have a child who might keep saying, कल फिर नानी के घर जाएंगे, कल फिर नानी के घर जाएंगे. Not talking about actually going to the nanny's house, that it may be a phrase. They like the sound of the phrase and they like repeating it, right? And these are some of the ways they keep themselves engaged, and this in their kind of play. Autistic बच्चे, by and large, they are not great fans of make-believe play. जो न्यूरोटिपिकल बच्चे बहुत मेक बिलीव प्ले करते हैं, ऑटिस्टिक बच्चे वो पसंद उतना नहीं करते हैं, बट दैट डज नॉट मीन कि उसका इमेजिनेशन नहीं है. इमेजिनेशन है, they just don't do that.
That's right.
Another thing that we want to look at is the pointing with the index finger, जो हम बहुत young age 15 months से start कर लेते हैं. So little babies, कोई चीज देखा है जो उसका पसंद है, if they like something, they will point at it, like I want that.
Yeah.
Autistic child वो नहीं करेगा. क्या करेगा? वो जो देखा है वो जाकर ले लेगा, या तो हम पकड़कर उस चीज में डालकर मांगेगा, right? But अपना फिंगर को पॉइंट करके they will not be doing that.
Okay.
The other thing is कि बच्चे around 15 to 18 months social referencing में क्या करता है, they point with their fingers to share an interest. देखा है बंदर आया है, they will point to the बंदर and they look to see if the parent or the caregiver देखा है क्या नहीं. So ये जो sharing of interest, हम देखे हैं, आप भी देखो, this is something that a lot of autistic people will not do. Even those who have a lot of speech, fluent speakers शायद नहीं करेंगे. Sorry. The other thing that they will not do is that हम यदि उसका attention draw करने मांगते हैं and we say, look, there's a cow there. देखो गाय है एक. They will not look at our finger and follow to see हम क्या दिखा रहे हैं. वो जो कर रहा है उसी में focus रहेगा. So हम जब उसका attention direct करने का कोशिश करेंगे, it will not happen. Very often. I'm not saying किसी, but everything that I'm saying, there will be exceptions to the rule.
Okay.
Always exceptions to the rule रहता है, but vast majority of them, this will be applicable. Another one is कि they avoid looking at people's faces. जब उसको कोई कुछ बोल रहा है, जो बोल रहा है उसका फेस की तरह देखना, आई गेज यूजुअली नहीं देते हैं. हम जब बच्चे को ड्रेस करवा रहे हैं, बच्चे हमारे फेस की तरह देखते हैं. हम जब खेल रहे हैं, हमारे फेस की तरह देखते हैं. और स्टैटिस्टिक बच्चे नहीं करते हैं, क्योंकि उसके लिए प्ले के ऊपर फोकस करेंगे प्लस दूसरे का फेस की तरह देखेंगे, इज टू मच. सो दे विल नॉट लुक, दे विल लुक एट. सो आई गेज, बहुत बोला जाता है ना, आई कॉन्टैक्ट. This is the reason why. उसका neurology अलग है.
That's right.
They a lot of sensitivity to sight, sound, smell. Mrs. Ruby Singh will be talking about it in much detail. But you know, they can often be bothered by very simple everyday noises, like balloon bursting. That is one a lot of autistic people have a lot of difficulty with. But balloon bursting is not a big sound, but their brains are wired in such a way that that can be a hugely distressing sound. कभी कभी पिकी ईटर्स होते हैं, शायद बहुत कुछ खाना खाते हैं मगर वेजिटेबल नहीं खाएगा, या तो कभी भी मुंह में क्यूकम्बर नहीं डालेगा. ऐसा एक दो फूड रहेगा जो एकदम खाने नहीं मांगता है. इफ यू प्लीज द नेक्स्ट स्लाइड. अनदर वन, अ रियली बिग वन, इज की रूटीन्स. बहुत रूटीन्स फॉलो करते हैं. दे लाइक रूटीन्स बिकॉज इट गिव्स देम, उसका लाइफ में रूटीन्स प्रिडिक्टेबिलिटी देता है, क्योंकि वो एक ऐसा दुनिया में रहता है. उससे हमारा सोशल डिमांड्स, क्योंकि वो लोग माइनॉरिटी है ना, हम न्यूरोटिपिकल लोग मेजॉरिटी हैं, तो हम अपना डिमांड्स उसके ऊपर थोपते हैं कि आपको ऐसा करना है, वैसा करना है, हमारे दुनिया में फिट करना है. सो द वर्ल्ड इज वेरी हार्ड फॉर देम, राइट? सो दे डेवलप अ नीड फॉर रूटीन्स फॉलो करना. सो रूटीन कभी चेंज होगा तो बहुत अपसेट हो जाते हैं. तो हम रोज जाते हैं इस वाले रास्ते से, कल कोई भी कारण से यदि हमको रास्ता चेंज करके दूसरे रास्ते से जाना होता है, वो शायद मे हैव अ ब्रेकडाउन राइट देयर, बा तब शायद ठीक रहेगा. स्कूल जाने का बाद देयर माइट बी अ एब्सोल्यूट मेल्टडाउन. या तो स्मिता मैम मैथ्स सेशन लेना था, मैथ्स क्लास लेना था स्कूल में, मगर आज प्रियंका मैम आकर मैथ ले रही है. They can have a meltdown, right?
Okay.
Even if they don't have a meltdown there, they will be very distressed. Afterwards, they may have a meltdown. और हम सोचेंगे कुछ तो नहीं हुआ था, क्यों ऐसा कर रहा है? But because the change happened, right? All of these can be very hard for them. And also, like I said, कुछ बोलते नहीं है, कुछ देरी में बोलते हैं. There will be children who are fluent speakers, absolutely fluent speakers, right? They are very good at studies, but they will struggle with writing.
Yeah.
Not then. They will struggle. लिखेगा, but it is painful for them. तो writing is a big problem. उसीलिए हम often बोलते हैं कि computers use करने हैं.
And distraction होगी, and there's so many behavioral aspects that you've mentioned in the slide. Ma'am, you're absolutely right. So what I figured out कि उनके social interactions में दिक्कत आ जाती है, उनके behavior में problem हो जाता है, communication में problem हो जाता है because of autism. But then हम ये जानते हैं कि इट्स वेरी इंपॉर्टेंट कि जब हम किसी इंफॉर्मेशन को प्रोसेस करते हैं तो हम अपने सेंसरी ऑर्गन्स को यूज़ करते हैं, सेंसरी प्रोसेसिंग का इस्तेमाल करते हैं, बट उनके लिए एकदम चेंज को अडाप्ट करना विच इज़ लिटिल इनफ्लेक्सिबल. सो यहाँ पर फिर कई बार हम उन्हें टर्म करते हैं, लेबल करते हैं कि ओ दे आर रूड, उनका बिहेवियर सही नहीं है, वो स्टबन हो रहे हैं, आर्ग्यूमेंटेटिव हो रहे हैं. सो रूबी मैम, हियर आई वुड लाइक टू आस्क यू, क्योंकि जब हम बात करते हैं सेंसरी प्रोसेसिंग की, कैसी टर्म है sensory processing differences which many of us don't even know about. So I just want to ask you one simple question कि जब हम बात करते हैं अपने sensory stuff की, organs की या senses की, कि हमने कैसे काउंट कर सकते हैं, क्यों हमारे लिए sensory processing differences को जानना ज़रूरी है? Because it's important to understand the why behind their behaviors, because it's a neurodevelopmental condition. तो जाहिर सी बात है इसमें आपके हर ओवरऑल आपका बिहेवियर इम्पैक्ट होता है, चाहे वो आपका वर्क प्लेस पे हो, सोशल सेटिंग्स में हो. मैम, इसके बारे में प्लीज़ थोड़ा सा बताएं.
I think Mrs. Ruby Singh will take that.
All right. So, yeah, Ruby ma'am, please आप बताएं
No,
इसके बारे में.
along with Mary. Thank you, Mary. I think the basic structure of the whole uh, idea behind a person with autism is
Yeah.
already been laid by Mary, and we all understand that they're different from the rest of the world,
Right.
and there is a reason behind it.
That's
Up till now, we were all thinking that, I mean, a lot of time people would say it is a bad parenting or not right environment given to the child, or not really well trained in life. But many a times frigid mother and all that, we've heard about it. My son is 31. Mary's son is even older than my son, so we all know what we have gone through as parents. But yes, it is not just they are different because of some reason at home. It is basically they are neurologically different in the way they are connected. The brain is connected, the brain is
Yes.
functioning, and the more research that is happening is going to throw more light on all this. So what we have seen is that it is neurologically, they don't have a choice. When the neurology, the brain system is so different, then they have no choice. I saw one slide that Mary has used. It's a beautiful slide, very well explained, that in a typical child, the input and the processing is so smooth that we all human beings should be grateful for that processing. Nobody thinks about it. But in autism child, the way it is scattered, as if it's a cluttered brain. No, not this. This is the one Mary has used is beautiful slide. I would borrow that from her.
Yeah.
See, this brain is so it's so well explained, and it's a real
True.
brain picture, so you can imagine how smooth our common people have the flow of information. And when something like that is so smoothly done, the information processing is so easier for
Yes,
normal
yes.
people. But a atypical child with autism will have atypical behavior, because every brain is so different. That's why we call it that every autistic brain is different. Now, if you see this slide that just shown, I normally say that if you look at the brain, if I show this as a brain, this is the stem, the spinal cord, the information that goes from the sense organ, the eighth model sense organ that we have. All these information can really uh, go through smoothly in normal people, but in autism children it doesn't go smoothly. And the problem is not just that the information taken by the sense organ is in the right form. We don't really know whether it is getting, the input is taken in by the sense organs are in the right form yet. But we presume that it is taken in rightly, but the transfer is happening through the neuron, and it is not happening in the right way, and is not being cataloged and received in the hub, that is the in cellular cortex that is there, where it is received and cataloged properly. So what will happen is that either a child with autism will be hypersensitive to something, some input,
Okay.
or will be hypersensitive, and that what will show his behavior patterns. So if he is seeking as putting everything into the mouth and going on licking at things, then it means that he is hypo sensitive to the taste.
So,
And
ma'am,
if he is
yeah,
hello?
so when a child walks out of the classroom just because he or she is unable to adapt to a certain scenario, we call the child as behaving badly. That should not be done, right?
No, it is because he is the overload of information or input. It could be the sound,
right.
or the clutter, or the color of the house, or the smell. So all the sense organ, whatever information is being passed on to the brain, the child, there is an overload in the mind, and he walks out of it to actually keep himself cool and not cause. So in fact, we should thank the child for being so considerate in the society these days. Not many people are considerate. Over to you, Mary. Is there
Yeah, but there's one more thing, Ruby ma'am, that I would like to ask you. That
Mary wants to say something, yeah.
yeah, please, Mary ma'am, if you wish to add.
Okay,
Yeah.
finish her.
Yeah. So basically, because you're talking about these senses and sensory processing differences, that's the right term you're using. There's also one model called octopus model. I think we all should know about it so that we can understand how that sensory processing is taking place differently in a child having autism. Ma'am, please explain that model to us.
Yeah, so see, sense organ we all know. Basically, we all remember the 5 sense organ basically. But in autism or in normal people, we take 3 other things, 3 other sense organ. We take it for granted. So, like an octopus, you know. Limbs that the octopus has is 8, and a child with any human being has about these 8 sense organ which is affecting his brain and his behavior. So if you see auditory, hearing the child will sometimes some of the children will not respond to their name or not respond when they are called, or even want to hear something. They would respond maybe when you speak loudly, some of them, but it is because they are not able to process whatever input is going in is not being processed, and they seek more. And so that is why they need more inputs for that, and then they would have a different some children would have a different way of dealing with it. They would be hypersensitive to the input. So auditory is related to hearing. Similarly, you have visual or a tactile. So touch or the visual. If you see a person with visual impairment in around us, you'll see that they have just one sense organ which is affected, and they have a certain way of behaving. You can make out they will touch and move around and try to understand things in a different way, have a braille book to read whatever they have to read. So things have evolved so much for a person with visual impairment. In case of a child with autism, it may not look as if he is visually not able to see like a person with visual impairment, but there is a problem with the processing of information that is happening in these children, and they will seek more, or they will either have, each case would be different. So some people would be wanting more input, so some people would be wanting less input, because it causes overload to them because it's too much. Similarly, if you see a person who's not able to, for hearing, auditory, in case of normal people, when they have auditory problem, the processing is different, and it causes them to be dumb, not able to communicate, not able to speak. In children with autism, it may not again be at the outward level that he is able to hear or not, but the processing of hearing input is in certain manner which causes them to behave deaf, and they are not able to hear, or they don't show any sign of being able to hear. So they will behave in a certain manner. So in case of autism children, when it is not just 2 sense organ which is affected, it's all the sense organ which is affected. So the kind of differences that a child with autism will have is so wide. That is why it is called autism spectrum disorder, because they are all in different levels. Some of them are hypo, some of them are hyper in certain areas. In some other area of sense organ, it is different. So it is children with persons with autism will have all these differences. I was talking about the 5 sense organs. So we heard about the auditory, the tactile, the visual, the taste bud, which is gustatory, and so you will find a lot of child who needs more, will be picky eater, as Mary just mentioned about it. May not like the food is one part of it, but it is causing him to have a lot of sensory stress by taking a certain kind of food. So they avoid those food. It should not be taken as a behavior problem. It is something that we have to really do sensory profiling, and to understand what step needs to be taken for that is depending upon the input of the child. Then again, olfactory, which is smell, to do with smell. Again, they will be smelling. Some children don't like the incense smell or the smell of a perfume and just gags or something. So this is again not bad behavior. It is because they have hyper or hyposensitivity to a certain kind of smell.
And they're unable to pay attention and focus, and we do not understand the science behind it, but we just term them that they're having bad behavior, or if they're not listening, paying attention, then when you do not diagnose, till the time you do not diagnose autism, you say that the person is deaf. But ma'am, there's one more thing, that it eventually impacts their learning also in a very big way, and you have presented that, presented the slide also, that impacts learning and behavior. And it's difficult for them also to adapt to the changing dynamics, and for people also, they don't also understand how to deal with kids who are neurodivergent.
Yeah, so they would have, because of this overload of information or the they need more, they crave for more information or inputs on certain areas, they would have meltdown, because it is like we are really cluttered. Their brain is so cluttered that they, after a while, it just triggers off and they cannot take it down, and then it shows in meltdown in many children. In adults, it may show it in a different way if they've learned the communication skills and they want to speak out, but they have problem with overload, and that is going to affect the learning pattern, because they need a certain kind of inputs and certain kind of support system, which needs to be understood by whoever is giving the input at home or in the schools. Again, they will have stimming behaviors like hand flapping, spinning. These can cause people to think that they are problem people, and people try to avoid, so they get devalued, and people don't try to associate and become friends with them. So it is a very everything is so holistic, because it is not just the child is alone in this world. It is a very organic system, and it all affects their learning behavior, because they will not have friends. In a normal case, four friends would sit together and eat or share. This doesn't happen for a child with autism, and we need to really go out of our way to ensure that we can overrule all these barriers
That's
that
right.
is caused because of the stimming.
So here the senses or sense organs play a very important role. As you mentioned, some are hypersensitive, some are hyposensitive. But though we have a list, हमारे पास कुछ ऐसे signs हैं जो early diagnosis करने में help कर सकते हैं, identification करने में, in layman terms I would say, help कर सकते हैं autism को. But again, we have a child who, let's say, is a fluent speaker. So Mary ma'am, I want to ask you, how would you identify the child who's speaking so fluently? It's one of the sense organs that's not affected, and he or she is whether autistic or not. कैसे identify
Right.
करेंगे उस case में?
So, sorry, the question was, how would you identify a
Child who's a
with
fluent speaker, because he's very fluent, is like neurotypical, as we say, right, in this domain. So how would you
Right.
identify in that scenario? Because in your list you mentioned that they have problem with communication, they don't hear, say they don't react the way we want them to react. They do hear, but they don't react the way that we want to. They don't respond efficiently or quickly. But here the child is speaking so fluently, and we tend to understand, because he understands things, he's responding nicely, there is nothing wrong or nothing problematic here. Then
Right.
the diagnosis or intervention won't happen, and it will lead to some kind of problems later. So इसके लिए हमें यहाँ पे tricky situations में what should be done?
So that's, the question is about the fluent speaker who is almost not identifiable.
Yes.
So there are some of the things which I already mentioned, like many of them who are fluent speakers, they struggle with writing. They are the ones who, when the teacher asks a question, are to wait and not put up their hands and wait for the teacher to tell them. They're constantly interrupting, constantly speaking out. And the other thing is that they tend to be perceived as rude, because for autistic people, they're very honest and straightforward.
Yeah.
So I had a young man tell me a few days back that आप तो बहुत old हो, आपको देखकर लगता है आप old हो, right? Now, that would be considered extremely rude in our society.
Yes.
But I didn't think it was rude at all. I am old. So if he's telling me I'm old, he's just stating the obvious. But we take it. And for them to understand these subtle rules, so they are very fluent speakers, but understanding the subtle rules is very hard for them and end up being seen as rude. Right? They will often, you will tell them, no, you should not do this. So they'll say, but why should I not? Because they genuinely want to know. They're looking back. They genuinely want to know. It doesn't occur to them that in our society, you are not expected to question an adult.
That's right.
So these are the things that you watch out for. They constantly get into trouble. Also, they would often seem stubborn and argumentative, something I put into the slide, right? It's somewhere there on the slide, doesn't matter. So they would be seen as stubborn and argumentative, and they often get punished. But if you see, because they're seen as bad, but when you see that the punishment is not showing any results, step back and consider whether the child is autistic, right? And many of them will have intense problem with sounds and stuff like that. Even if they're fluent speakers, they would also have difficulty, fluent speakers, of going back home and telling their family what they did in school.
Okay.
Coming to school and being asked what you did in the holiday, to be able to give a great answer, or even in the class, when the teacher asks a question where the answer is contextual. When it's contextual, in the initial phases, we have passages like the boy is called Ruby, the girl is called Ruby, the boy is called Savan, they are brother and sister. So if you say who are brother and sister, Ruby and Savan. If you say who's Ruby's brother, that kid will not be able to answer.
Oh.
The processing.
Because you have to look at the context.
Savan won't come so naturally, yeah.
But what is there? They'll pick up the whole sentence and give you an answer. But the moment it moves to a context, it becomes difficult. And it is not because they are not intelligent or there is a cognitive problem. हमें ये ध्यान में रखना है कि जब इन जो डिफिकल्टीज हो रहा है, क्लासरूम में भी डिफिकल्टीज होता है, ये कॉग्निशन से कनेक्टेड नहीं है. Of course, there are some autistic people who have intellectual disability, but it is the same percentage जनरल पॉपुलेशन में पीपल विद इंटेलेक्चुअल डिसेबिलिटी जैसा है, ऑटिस्टिक पॉपुलेशन में भी इंटेलेक्चुअल डिसेबिलिटी है. बट द वास्ट मेजॉरिटी ऑफ देम डू नॉट हैव इंटेलेक्चुअल डिसेबिलिटी, बट बिकॉज उसका अंडरस्टैंडिंग इज डिफरेंट. उसको हम जब सिखाते हैं, एक बहुत बड़ा अकोमोडेशन इज लर्निंग, एक्सपीरियंशियल लर्निंग. वो हमारा एवरी प्लान में रहता है कि एक्सपीरियंशियल लर्निंग होगा, बट कोई स्कूल में नहीं होता है. हर स्कूल में चॉकबोर्ड एंड बुक से होता है, कोई एक्सपीरियंशियल लर्निंग नहीं होता है. मगर एक्सपीरियंशियल लर्निंग करे तो ऑटिस्टिक बच्चा सीखेगा, द वन विथ लर्निंग डिसेबिलिटी सीखेगा, द ब्लाइंड चाइल्ड विल लर्न, एवरीबॉडी विल लर्न.
डॉक्टर मेरी, मैं आपसे यहाँ पे ये भी पूछना चाहती हूँ कि जो ऑटिस्टिक बच्चे होते हैं, डू दे कम अक्रॉस एज मैनिपुलेटिव आल्सो बिकॉज ऑफ देयर बिहेवियर एट टाइम्स?
आर दे सीन एज मैनिपुलेटिव?
या
समटाइम्स दे आर बिकॉज दे परसिस्ट. एंड लोग सोचते हैं कि ये मैनिपुलेटिव है. नो, दे आर परसिस्टिंग बिकॉज ये तो करना है. यू नो, फॉर इंस्टेंस दे विल डू थिंग्स लाइक, इफ यू हैव सेड दैट you should never tell a lie, right? And then if the father is lying to a colleague कि नहीं हम तो कल आंसर नहीं कर पाए थे क्योंकि हमारा तबीयत ठीक नहीं था,
right?
The boy say नहीं पापा आप तो टेनिस खेल रहे थे. And then the father will, oftentimes families say, oh, he's just manipulating us because he wants something out of us.
That's right. Ma'am, so the way,
but
yeah. So the way the kids are processing information is totally different, and because we do not have awareness regarding autism, we are labeling them as manipulative, rude or unmanageable, difficult children. But आपने भी school settings की बात करी, that we are talking about experiential learning. It's not just about the domain of education, but as such in society also there's a lot of stigma attached to these disorders or conditions. Because हमें नहीं पता है तो हम उसको एक taboo की तरह लेते हैं. First of all, it's not normal or typical for us, and then we tend to bully them for the things that they don't have control at. So I just want to ask you कि ये भी बहुत ज़रूरी है, क्योंकि सोशल सेटिंग्स में जो टीचर है, स्पेशल एजुकेटर को तो खैर पता ही होगा, पर जनरली जो टीचर्स हैं या पेरेंट्स अपने बच्चे को स्कूल भी भेज रहे हैं, दे मस्ट नो दैट दे कैन बी अ टारगेट ऑफ बुलिंग. Right, ma'am? What do you have to say about it?
Yeah, extremely. See, for autistic people, they often don't understand facial expressions and body language. ठीक है? So, like, say, even if I'm talking to you and this kid, and I wink at you.
Yeah.
Definitely sharing a secret. But that boy will think, अच्छा, आँखें ऐसा कर रहा है. अच्छा, wink कर रहा है, they won't understand. Often they don't understand when a classmate is joking or is being serious. And many kids, they figure out that this boy understands things differently, so they will try to act very friendly, and the autistic person will not understand, is the boy trying to be friendly with me or is he trying to harm me? So one of the common things that happens in school is they will tell the autistic kid, teacher ko jaakar na ye gana suna do, and they will suggest a really risk song for them to sing. So the boy goes and sings some risk song which is inappropriate. He will go and sing it to the teacher, and the teacher will say, "How dare you do that to me?"
Yeah.
He will not be able to say, "हमको उसने बोला था."
उसने बोला था. They're very vulnerable, basically. Yeah.
Also, they will be bullied by their pencils being broken, hit, all that kind of stuff. But the other kids will do it जब teacher नहीं है सामने.
That's right.
Now, when the autistic people is not able to take in, बहुत दिन से चल रहा है, एक दिन जब उसको मारेगा ना, वो टीचर के सामने ही मार देगा.
Yeah.
So, से देखो कितना वायलेंट लड़का है, उसको मार रहा है.
Exactly.
You will know that the kid has been at this person endlessly.
Absolutely.
In fact, shown worldwide that autistic kids are the most bullied population in schools.
Yeah, of course.
That's right. You're so right, ma'am, because हम बैकग्राउंड तो समझते नहीं हैं और हम अपनी जनरलाइज स्टेटमेंट्स दे देते हैं और वैसे रिएक्शंस दे देते हैं, और वो उस पर्टिकुलर बच्चे के लिए और ज़्यादा डिफ़िकल्ट हो जाता है फॉर हिम टू इवन अडैप्ट मोर. अब यहाँ पर बहुत ज़रूरी है दैट वी identify at the right time, we assess at the right time, diagnosis सही से हो, ताकि early intervention strategies की help से हम इन conditions को successfully manage कर पाएँ. Again, जैसे हमने अब तक discussion किया, क्योंकि हर condition में जो degrees होती है वो vary करती हैं कि कितने % उस चीज़ से, उस disorder से या उस condition से एक बच्चा affected हो सकता है, उसका problem हो सकती है. So it's very important to understand all these strategies and the screening tools available. So Ruby ma'am, I want to ask you about all these intervention strategies and the screening tools that are available, because as a parent, सबसे पहले चीज़ घर से start होती है. I should be knowing about it. A teacher should know about it, and as peers, as society members, we should be knowing about it.
There is some problem with the sound. You want me to
talk about the screening tools and intervention strategies that are available?
Yeah, so there are two different levels. First, when the moment there is some red flag and somebody points out, then the screening should be done immediately so that we can go on to intervention and assessment and then certification. And identification of the child is so important. So
yes.
What normally identification happens, the first line of identifiers are the Anganwadi workers, the school teachers, the family and people around you, and of course the parents. So there is something that is commonly used is NCERT, which is really a very simplified screening tool which can be used. It's a question answers, yes no question answer. Even rural parents can give the yes no question answers, done by the health worker in the Anganwadi or any other places, where that is just to identify whether the child needs to be referred to the higher level. That is the second level of clinical or a professional doctor who would be doing the assessment. But the very first tool that is used is NCERT. In world over, it is used. The Indianized versions are being used. InClean again is a tool that can be very helpful. Can we go to the next slide, please? Because we have SCQ, that is this is the referral chart. We can come back to this later on. But the screening tools that we have is InClean, that we use in ASD, which is again Indianized tool being which focuses on early identification of a child with autism, and then they can be referred to the next level. We They also use the the 40 questions, that is the social communication questionnaire, which can be very pointed, so that you can make out that the area of communication is affected, and whether the child is verbal, non-verbal, all that can be pointed out from these few tools, which is basically used at the screening level of the first level, wherein it is used basically by the Anganwadi workers, the health workers, or the parent, or the not really clinical professionals can also use these tools. So that is one. Similarly, just the next step after that is to be referred to a second level of screening, which is again the assessment, the
That's
actual
right.
assessment whether the child has autism, and if he has autism, as to what level of intervention is required for the child. Because before he goes into it, immediately the moment this assessment is positive, the parents are told to go and seek for the intervention to the district early intervention center, if they are referred. And these are the tools which can be very helpful. Isha is one of the tool which is basically again being done in India, and is very contextual, and is very right for the Indian context. So, and it is used predominantly for certification, but it also points out what is the level of autism, that a
Right.
level of disability or difficulty that child is facing, and that can help
True.
in planning the interventions, the early interventions, or the therapy, or the structured program
Right.
that is there.
Ma'am, we
So
request you to kindly expedite your answer because we have very little time left in the session now.
here, I am not able to hear you
I
clearly.
request you to kindly
Some-
speed up. Yeah,
was-
yeah. Kindly respond shortly because we do not have enough time left in the session, ma'am.
Yeah.
Am I audible to you, ma'am?
I'm not able to
Okay.
hear you.
Basically,
So,
ma'am, we do
okay,
not have
fine.
enough time left, so please request you to kindly conclude as early as possible. Yeah.
Okay, fine. So this after the assessment, the certification is also very important, because the certification helps the child to get so many services which is available. I'm not saying everything is
Yeah.
hunky dory, but whatever is available in India can be assessed only after the UDID card or the certification is done. So all these assessment is very important.
Right.
There are several tools that we use in India.
Yeah, that's right, because we need to go for the assessment to the medical practitioners, and let's not try the other way around, because if you'll delay the assessment, you will delay the intervention. So now, Mary ma'am, I want to ask you that we need inclusive settings for autistic people. What according to you would be ideal inclusive setup for autistic kids? Very rapidly, ma'am.
I think that, Harpreet, I just want to quickly say that, we have these ratings of, what level percentage of autism there.
Yes.
For autism, actually, that doesn't really work. I know we
Okay.
have it,
Yeah.
but it doesn't, because in autism, the chronological age and the developmental age do not align like it does other people, right? All people. Autism is marked by very spiky skills. So you could have a kid who has no speech, but has a great memory for every song on earth. You have a 3-year-old who has taught himself and is a whiz, 3-year-old, whiz at the computer, but he can't dress himself. And you have a tech who can't even tie his shoelaces.
That's right.
Right? Where are we going to put them on this thing? So, the spiky skills. Anyway, to come to inclusion, what would be the most inclusive setting? A most inclusive setting would be one, which would be for anybody with any disability. Have a proper understanding of the disability and not understanding based on the behaviors that we see, but what is the really disability about, and providing an environment that is structured, that is consistent, predictable, where the communication is clear. We were talking earlier about kids, who come to the classroom because they are feeling upset. They are feeling upset because the teacher's instructions were not clear.
Yes.
Autistic literal speakers. They understand clear literal language. They do not get sarcasm. And if the teacher says, "Marzi ho to kitab kholo," now all the kids will open their books except the autistic kid. वो सोचेगा, "जी
yeah.
मेरा नहीं है."
Ma'am, you're
So-
right. So there's so many things happening, you know, even teachers are unable to understand them. You said that the certification होना नहीं चाहिए, but eventually होता है, so that उनको benefits और facilities दी जा सकें. कहीं ना कहीं ये चीज़ें भी एक तरीके से open, yeah.
They can be skillless learners. They complete their schooling.
Yeah.
They can go to college. They can do
Lot of
university.
things.
There are PhDs with autism.
But ma'am, even then, you know, children are still somewhere embarrassed and they do not want to be, they're wearing a mask. They don't want to come out as autistic person. उस केस में what would you say कि इस चीज़ को हम कैसे reduce कर सकते हैं या इसको remove कर सकते हैं rather completely?
See, I would say that autistic people mask not because they don't want to, they're ashamed of it. No,
Okay.
they mask to survive.
Because they're
Chalega that you're autistic, people will start treating you differently.
Right.
So they mask to survive. And in a company, we know people who are working in companies who've had this discussion, should I tell my company that I'm autistic? And we said, no, don't. Because the minute they find out their treatment of you, they'll use the label to treat you badly. People mask to survive, and mostly you will find that, you know, autistic girls,
Right.
they are usually not identified. There are as many autistic girls as there are autistic boys.
That's right. This is a myth that needs to be busted. Ma'am, we know we do not have enough time left, but there are few myths and few facts. Yeah.
Certain sentences. One is that it is harder to spot autistic girls
Yeah.
because they're better at masking. From the
Okay.
time little, they learn that I have to copy other children and behave and play like them so that I'm not treated badly, and girls are better at that. So it is a child who's going to school and seems fine at school, but comes home and is overwhelmed, anxious, or has a meltdown. That's a red flag. That's
Alright.
probably an autistic kid. Because he seems to be doing okay,
Right.
but as soon as she is going home, is having a meltdown.
That's
so
right.
we have to realize that masking is a necessity. They do it because to survive, not because they're ashamed of it.
Oh yeah, that's a very, very nice fact, ma'am, that you have shared with us. And Dr. Ruby and Dr. Mary, I want to ask you one thing. There are certain myths and facts associated with identification diagnosis. Just very quickly, I want to ask you one thing. Autism can be diagnosed with a brain scan or a blood test. Would you say it's a myth or a fact?
It's a myth.
It's a myth.
The biggest myth ever, yeah.
Yeah. Okay. The next one is, though you have already cleared, if a child talks, they can't be autistic. It's a myth or a fact?
It's a myth. There are lots of them who are talking, they're fluent speakers. There are actors who are autistic.
Right, ma'am. And Ruby, ma'am, there is a myth or a fact thing
Yeah,
for
many
you also. Do we need to wait until the age of 3+ to screen, or they might grow out of it? Is it a myth or a fact?
No. The
They never-
earlier the better, as
Okay.
early as possible. Any kind of assessment can it means that we can immediately start
That's right.
interventions, and the brain plasticity is there, so the brain really functions and can improve if the intervention starts as early as
Right.
possible, for which assessment is required.
Okay.
Also, I want to say about the sensory profiling. If it is possible for a child, it helps to identify which areas of
All right. Okay. Sure. Thank you so much, Dr. Mary. Thank you so much, Ruby ma'am, for throwing light on this wonderful topic, which is all about early identification, assessment, certification. There were a lot of things that you discussed, still a lot of things remaining, but due to time constraint, we won't be able to take this conversation ahead. But I would like to thank both of you for your contribution and for your support and for helping us in raising awareness and promoting inclusion and equity in the area of autism, be it at workplace, education, or any other setting. Thank you so much for your time and contribution to the session.
Thank you.
Thank you so much. I would also like to thank both our ISL interpreters Mr. Dev Malik and of course Ms. Anu Malik for their continued support, and my entire team for making the session a success. So today we are wrapping up day 2 session over here under the umbrella theme of understanding autism, seeing strengths beyond differences. And tomorrow on day 3 we will be bringing you another topic, which is going to be behavior, communication and learning needs, inclusive education and classroom strategies. There is a lot that will be discussed tomorrow, so we will definitely see you there. With this, it's a wrap. This is me, Harpreet Kaur, signing off. Namaskar.